Hi, welcome to Health Stories Project. I'm Susan Branzell here with our live broadcast today, and we're going to be talking about HIV, stigma, and disclosure. We were scheduled to have 3 guests today. We have some technical difficulties and some personal events that have arisen. So right now we have with us 1 guest, and we may be adding the others as the show goes on. But please bear with us, and I'll introduce our guest in just a minute. Just to remind everybody, Health Stories Project is a community that anybody is allowed to join. It's a community that has multiple opportunities available for people to share their health stories. We believe this will help people to feel more supported, to feel part of a bigger whole, and people really learn from each other by hearing each other's stories. So if you're interested in signing up for our community, please go to our website, healthstoriesproject.com, and click on Join. Thank you again for coming to watch today. This is a really exciting and important topic. And I want to also say that we're honoring National Black HIV Awareness today. It happens to be that day on the calendar. So we're really pleased that we're able to broadcast on that day. Before we start, just wanted to invite those who are watching to share their comments or their questions along the way. And we will answer those when the timing is right. And also, again, just sign up for our community if you're interested. So also, I wanted to remind people that we are not here to give medical advice today. So if you hear something that causes you to ask a question about your medical condition or someone else's, it's best to ask those questions of a healthcare provider, as we are not healthcare providers here at Health Stories Project. All right, we're going to start off our discussion today. I'm really honored and excited to have Marvin Anderson with us. Marvin will introduce himself in a moment, but he's joining us actually from Birmingham, Alabama. He is a man of many talents. He's a communications specialist. He's an activist. He's a preacher. He's an advocate. And he is going to tell us his story today. So Marvin, thanks for coming to join us.
And thank you so much for having me. I am excited to be here. So,
great. Me too. Maybe we can just kick off by having you give a quick introduction about yourself, about HIV, and then we'll start talking a little bit more about the work that you do. I also, failed to mention that Marvin started an important advocacy organization called stigmocracy.org. Is that right, Marvin?
Yes.
And so if you're interested in taking a look at his organization, check out stigmocracy.org. Okay, go ahead, Marvin. Tell us about you.
I am in Birmingham, Alabama today. I'm here. I'm at work actually at our headquarters here at Southern AIDS Coalition, which I'm the new communications manager here with this fabulous organization. My home plant right now is Atlanta, Georgia, by way of my hometown, Baton Rouge, Louisiana. So in the last few months here, I've been kind of all over the place. So today I'm here in Birmingham. And of course, this topic and this subject is very important to me. I've had an opportunity to talk before about my story and what it was like to come back and to deal with and to experience HIV and the advocacy and the disclosure and the effects of it. As it personally affected me in 2014. And actually today will probably be my first time actually being on a national platform, actually talking about my experiences personally, being an African-American HIV positive male.
So Marvin, I just want to acknowledge, I realize that takes a tremendous amount of strength and courage. So congratulations to you for stepping up to do that.
Well, thank you for giving me a platform to do that. So
absolutely. Can you tell me just a little bit more detail about sort of where you were when you found out you were HIV positive, and maybe a little bit about what you were feeling?
So I actually, I decided that, because at the time I was living in another state, and I decided that it would be awesome for me to return to my home state and city, which is Baton Rouge, Louisiana. I was in Los Angeles, and I, saw the numbers, which were astounding, that my city was actually number 1, and it continues to be even now, according to the 2016 surveillance report from CDC, that Baton Rouge, Louisiana was number one with
And when you
new
say
HIV.
number one, you mean in terms of the number of people who are HIV positive, is that right? Or who are being diagnosed with HIV?
New HIV/AIDS diagnosis per capita.
Okay.
So it's like, well, I would like to go back and do that work. And so it was in the process of me going back, doing the work, kind of like getting involved. And I just said, oh yeah, I'll do a test. And that's how I found out. But because I had some knowledge of, HIV and the science of it and the medical part of it, I was not overwhelmingly alarmed. However, being personally affected by it and the disclosure part was very frightening. Because I had other stuff going on as a community leader, community activist, minister, just so many other things. And then being in the Bible Belt or the South, just the stigma that was attached to it was just quite overwhelming.
So I'm really glad that you brought up that topic, actually, because I want to talk a little bit about geography and really about the South. Can you say why the South is unique in terms of how HIV is talked about and dealt with? And if it's relevant to talk about the African American community, or maybe that's general in the South, regardless of race or ethnicity?
Well, let me start off by saying that the numbers have determined that this issue is that the mathematics have determined that this is a problematic issue. And with that being said, as we look at the numbers today's National Black HIV/AIDS and Awareness Day, when we look at the numbers, we understand that in the South, that African Americans make up 20% of the population. However, we make up 54% of HIV/AIDS diagnosis. And so that is disproportionately overwhelming and alarming. I would like to say, and I would like to think from my own personal experience, that stigma plays a very, very grave role in the continuum of the epidemic and the growth of it. Secondly, I would like to say that for myself, coming through as you mentioned, that I'm also a minister, ordained licensed minister. And so in the South, specifically the Bible Belt, which is driven by a lot of evangelical Protestant belief systems, no judgment, just speaking what it is. Those systems kind of make the HIV as well as the HIV conversation and the topics, we make it a moral issue and not a health issue. And therefore it contributes to the continuum, and we continue to deal with the stigma, and we continue to deal with the onset and the overwhelming invasion of the HIV epidemic. And so if I could speak to one side of that from my own personal experience, that's what it would be. Yeah.
Okay. Yeah. So Marvin, when you found out you were positive, did you feel that stigma, and did it affect your disclosure process?
Absolutely. I'm disclosing today. I'm sure that many of my Facebook friends or many people that, will see me on today, only a small nucleus knew. So today probably would be, this day would be monumental, because a lot of people I have not had this discussion with. They know me as a public speaker, they know me as an empowerment coach, and they know me from doing this work, but they don't know me from being affected personally by it. And so it absolutely has. In this moment, I'm going to try to keep from being emotional, but in this moment,
it's okay to be emotional. It's an emotional issue.
It's very freeing for me today. And what I want people to know is that, it's very hard to try and be authentic and do the work and to put a dent in this epidemic when you're affected by it and you don't feel like you're in an environment that's going to embrace you. But I will say that as I begin to evolve and disclose to a small group of people, and a small group of people that I felt cared for me, that the response was positive. and that I did not get an overwhelming amount of negative feedback. And so hopefully today will stand true for that as well.
I hope the same. I don't want to dwell on the negative, but I know that there are probably some people watching who are either worried about having negative responses or who have had them. How do you deal, or how do you prepare yourself to deal in the case someone isn't as understanding as you hope them to be when you disclose your status? Do you have any advice for people, or do you want to share what you do in your own mind when that happens?
Well, first of all, I think making sure that you have a support system in place. For me, before I disclose on a larger platform like today, I begin to share with individuals that were close to me, so that I could have that support. And when I began to share with individuals that were close to me or that were in my nucleus, it gave me a little more strength. You know, every time I got a smile or a hug or it's going to be okay, it gave me a little more strength to go further and to discuss and to disclose. So having a support system in place, going to those individuals that you may be fearful of, but if you really feel in your heart that you're loved and that they care about you and they care about your existence and they care about your life and who you are and who you've been predestined to be, then you should be able to share with them and get a positive response and get a support system to stand on to go farther and become a greater advocate and to disclose your status. And hopefully I answered that question.
Absolutely. But I am going to push on this a little bit because I recognize also that having friends and family isn't necessarily something to be taken for granted. There are people who are unfortunately not feeling like they have anybody in their personal circle who they can tell.
Absolutely.
Are there any recommendations that you have for maybe organizations, whether it's stigmocracy.org, Southern AIDS Coalition, that people can contact should they need support regarding disclosure and stigma?
Absolutely. You know, agencies, local agencies. I know that in Baton Rouge, there are several local agencies that were available, Metro Health, Heart. You know, there are a lot of organizations that are local. And so you're absolutely correct. And thank you for bringing that out. That there were times before I even went to my family. So thank you for bringing it back to my recollection. That my mind is that before I did have these AIDS service organizations or HIV service organizations or community organizations that offered a hand or that offered information or that offered support groups that you could go to. And so I know at stigmocracy.org, we can connect you and link you, but then also if you Google in your local area, organizations and networks and support systems specifically for HIV and HIV diagnosis, then that would absolutely help in the process. Absolutely.
Great. And that's actually a perfect, thank you for sharing that idea. And again, I think both of us are really trying to convey the message that no one is alone, even if they feel that way. I want to hear a little bit about stigmocracy.org and how that idea came to mind, and maybe a little bit about what your organization's goals are. Can you tell me about that?
Absolutely. So Stigmocracy birthed out of my own pain. It came birthed out of me actually experiencing stigma before I disclosed. It came from me experiencing stigma in the healthcare arena. Just to be honest, I went to the doctor one day and I had a cough, and the cough just wouldn't go away. And so when I went in, and I'm sure I have nurses in my family and medical professionals in my family. So when I went in to be seen, the nurse asked me a series of questions, and a series of questions I felt were quite inappropriate. And I felt that they were asked of me because of my diagnosis and because of what the assumed connection that I had to a community. And so I was angry about that. I was upset about that. And then
you felt judged?
I felt judged. I felt shamed. Just the fact that you would even ask me that question based upon what you perceived or what you thought, not facts. You understand? And
Yep.
so, and I felt categorized. I felt ostracized, like I'm in this category. So I'm not a regular patient. So I don't get the regular triage questions. I get an extra set of questions because of perhaps you may think you know who I am or where I'm from or what I'm dealing with, right? And so I absolutely, and I didn't like it. And then I would see other individuals that would go through processes of stigma. And I, as I began to do the work and began to enter into rooms, I would hear these stories that were so overwhelming about individuals who were not in care, who didn't want to get tested, and who almost had near death experiences because of stigma. And so stigmocracy was, what can I do? What can I do to combat this whole issue of stigma? And it became very dear to my heart. And so Stigmocracy is an organization that we advocate against stigma that is directed towards those individuals infected or affected by HIV or AIDS. And so that's our mission. That's our mission.
Marvin, I'm really happy to tell you that Khafre has been able to join us. He's about to be brought into the conversation.
Awesome.
So bear with us. There he is, the man of the hour. Khafre, it's so good to see you. I'm really glad you were able to join us. Thanks for coming.
Alafia, and good afternoon.
Alafia, and good afternoon to you too. It looks like his name is not showing correctly on the screen, but it's all right. We're good. Nice to see you again. I am in the middle of talking to Marvin about stigmocracy.org, and I hate to sort of quickly turn the conversation, but Marvin will understand. Khafre, if you could take a second to introduce yourself, tell us just in a quick minute, and I realize that's kind of unfair to ask, who you are as a person, what your mission is with the Southern AIDS Coalition as well.
I am Khafre Abif. I've been living with HIV for 29 years. I've been thriving with HIV for 23 years. I am the community organizer with the Southern AIDS Coalition. I'm an open and honest bisexual activist, artist, writer, editor. In my work as community organizer with the Southern AIDS Coalition, I work to empower people living with HIV, to amplify their voices around creating change and policies they want to see in their own health jurisdiction. Much of our work going into this year will be about reducing HIV-related stigma and its effects across the Deep South, and how that stigma plays out in people not getting tested, how people show up in space of not sharing their own story, particularly, and that thing about not sharing your story, how that holds people in isolation, and how that isolation works to create just poor health outcomes. Because if I'm in isolation and I'm not connected, that's when your body's not working fully. Because for me to be healthy, I need to be in relationship with community. I need to be touched by community, but I also need to be free from the mental anguish of holding on to a secret. And so if I'm free of that, then I can step into space of who I am. And I tell people all the time across the South that the longer I've been standing in my truth, the longer I have, a longer opportunity my family has to come and stand beside me. So even when they may not see you first and they may not be able to get there, you can continue standing in your truth, and they'll eventually come and line up right beside you. And so a lot of that work really is about getting people to, one, tell their story. Maya Angelou said that there's no greater agony than an untold story.
Marvin, if you can hang on one more second, I'm just getting Khafre aboard here. Khafre, when you were first diagnosed, which you said was 29 years ago, did you have this kind of self-assuredness at that time, or did you personally go through a phase of being worried about what other people would think?
Oh God, yes. Like I said, I was not. I was living, but I wasn't thriving for many years. It took me when I went to get tested because I wanted to ask my first wife to marry me, and I had known that my behavior, meaning being a bisexual man, I had unprotected sex with both men and women, men and women, but I also didn't know my status. I told my girlfriend I was dating, when we started dating, I was a bisexual man. And when I decided I wanted to marry her, I went and got tested. I tested positive. I told her I was positive and told her in a way that I wanted to leave the relationship and allow this young lady to go live her life. That didn't happen. We ended up getting married and having a child. She was negative throughout that pregnancy. My son was born HIV negative. But for 5 or 6 years after that, she was the only person who knew I was positive. That isolation was very, very difficult. That isolation, that mental anguish of being one thing in private, but having a very public professional life as a children's librarian. And so the stigma of being HIV positive kept me from tapping into my own health insurance. I didn't want people to know I was HIV, because in isolation, my mind was, if my employer finds out I'm HIV positive, they're not going to allow somebody who's HIV positive to tell stories to the children in the children's room. I thought my career would be over. So I'm carrying all that with me, right?
So what made you turn the corner? What was the pivotal moment, or was it a slower process than that made you start to disclose? It really was.
I mean, it came into starting advocacy in quiet spaces where they were in community planning councils and in state HIV prevention planning groups, where I could be who I was fully in that space. It was also a confidential space. But where the shift was is in July 14th, 2005, I returned home from my library career to care for my mother, who had cancer for the second time. And when I went home thinking I was going to care for her, she actually transitioned a year to the day I went home. And so July 14th, 2006, she made her transition. For that year, I thought I was going to care for her. She was caring for me. And she was continued to speak to me. When are you going to walk in what God has purpose for your life? She kept telling me that
she was a really big inspiration to you.
She released me from what the shame I was carrying, because she basically was saying that you are my child. I am not ashamed of you. And how dare you allow anyone else put shame on you? You're a child of God. And so she was saying that, you're going to continue to struggle until you step in to what God has purpose for your life.
That's a pretty powerful story. Thank you for sharing that. Believe it or not, gentlemen, Brandon is now joining us. I'm pleased that we've all ironed out our bumps in the road, if you will, and we're going to give Brandon a chance to introduce himself real quickly. Brandon is joining us from Queens in New York. Shout out to anybody who's in New York, right, Brandon?
Hi, New York.
And everywhere else.
Sorry, my computer's just been hitting the fan, so I'm hoping everything stays the way it is right now. So
okay, well, we'll get from you what we can. Brandon is an actor. He is a drag queen, and through those channels, he helps to advocate for people with HIV. So, Brandon, if you want to take a second to give us your personal introduction, tell us a brief history of your story with HIV and of your career. And of course, that's a long topic to introduce in a short period of time. So, thanks for keeping it tight.
Of course. So yeah, I've been living with HIV for 3 years. I was diagnosed in December 2014. Actually, it's going to be 4 years this December. As a drag queen, I feel that we already have a form that's pretty mainstream now, especially things like Drag Race and such. So I try to be very transparent with my own personal life, because I find that actually it helps me accept it a little bit more as I talk about it more, if that makes sense.
And did that happen right away when you found out you were positive, or was that something that it took you a little while to get to? It
took a few years for me to actually come open about it. In the beginning, obviously there was a little denial. There was, I had a very, give me 1 second, I'm sorry.
Sorry.
It took me a little bit. I definitely was very, I rejected it for a bit. And I, did the whole drinking binge, and I don't know. It wasn't easy for me in the beginning. It, like I said, it took me about 3 years to come open about it. But once I did that, I felt like I lifted something off my chest. It was much easier for me to start talking about it more. And as I kept talking about it, it got better for me each time. So
That's
what
great.
I'm doing with the drag, though, as I mentioned to you earlier, I work on Fire Island. This year, actually, I'm taking over the testing for HIV. So I'll be doing that out on Fire Island. Last year we had a person, but they don't live out there, so they're not able to be out there 24/7. So me being a resident out there, I'm actually going to be conducting, doing the testing out there. So
are you going to be doing testing in drag?
No. I don't. I think there's probably a lot of health codes that would violate with that. So
yeah, sure, I understand that, but that's great to knowing that there might be quite a few people who would feel that that's a safe environment to offer that service. So that's great. I want to jump back for a second to Marvin and Khafre, who both now work for the Southern AIDS Coalition, and give each of you a chance to speak about what your primary agenda is, in particular with regard to the HIV epidemic in the South. Khafre, you spoke to it a little bit with regard to obviously decreasing stigma, but can you guys talk a little bit about individual programs or something you really want to highlight about what Southern AIDS Coalition is doing?
One of the most exciting things about last year was that we rolled out our LEAD Academy. It's Leadership, Education, Advocacy, Development. And we did that in Columbia, South Carolina, in Jackson, Mississippi, in New Orleans, and in Baton Rouge. Okay. The exciting thing is that Marvin was one of the men who completed all 3 trainings in Baton Rouge, and now he stepped into the role as communications manager for the Southern AIDS Coalition. I mean, I could not be more happy for that kind of process to happen, and to be able to bring one of our leaders that intimately knows the work of the Southern AIDS Coalition on. I think what else we're doing that we do around it's around our federal advocacy work is done at the federal level, right? Mm-hmm. But we also do work at the state level doing technical assistance with state-based coalitions to help build them the capacity to be what they need to be to advocate at a statewide level in their state around issues that affect the lives of people living with HIV, but also making sure that they have an ear and they are recruiting people on the ground living with HIV to be a part of that coalition. And then the LEAD Academy is about building that work, building those leaders, building those voices so that they can connect and tell not only their local state politicians, national politicians, but also to tell the coalitions where they want to see the work being done and be drivers of that work at the local level.
Great. Marvin, can you add anything to that, or has he said it all?
Well, specifically, absolutely correct with the LEAD Academy being very instrumental in changing the trajectory of my life. In that I'm here, but one of my roles as the communications manager, that same LEAD Academy that I came through there, as we revamp it and restructure it, and to continue to build capacity in advocates across the country, we are going to be this year actually working with 6 different cities to actually develop campaigns for their specific city, for their specific market, for those individuals that's connected to whatever that issue or disparity or health matter may be. And so I'm really excited about that, and that I get to not only have been a person to go through the academy, but to graduate from the academy, to now be connected to the organization and being able to help now go back and build that capacity in other communities and in other advocates.
That's great. So you're actually doing customized work based on knowing that there are regionally specific issues and feelings.
Absolutely.
That's a really, really fantastic idea. Thank you for sharing that with us. As you all can imagine, this time has flown by, and we're going to switch over to maybe a few questions from our audience. We've had a lot of people making some comments, but my team here is drumming up the questions, is going to share those with us. So bear with us for just a second. Brandon, let me ask you a question while they're searching for questions for us. Are there people in your life who do not know that you're HIV positive?
I don't think so, because actually I had a misfortunate thing. When I posted on Facebook, there's some family members that are not on Facebook. I had a cousin that actually, she thought she was doing something good, that reached out to all my family members and told them, especially my grandmother.
Wow.
who I was not really wanting to tell because I felt at a certain age she didn't need to know, because it's not like I'm dying, so I didn't feel the need to actually have to tell her. But as I think it's right now, everybody knows.
Okay. Khafre, I want to, oh, sorry, Marvin, were you going to say something?
I wanted to say, since we're going to the audience, I did notice Oscar Lopez, who's actually a viewer, and I saw it go across the pan, and it said stigma, 3 question marks, and it said, are we still here? 3 more question marks. And Oscar, what I want to say to you is, number one, thank you for being engaging, but I want to respond to it and say, yes, it's still stigma and it's still here. And I always like to say that you may not be suffering, or you may not be affected, because we're not suffering, but you may not be affected by HIV onset or directly. But what we can appreciate, and what we can use your help by becoming an ally or an ambassador or an advocate. There are many different facets that you can become involved to help us do this work. And you don't necessarily have to be someone who's thriving, as Khafre would say, with HIV. You can still come align and assimilate yourself and to still help this epidemic. But Oscar, unfortunately, stigma is still very much alive. And I think, Susan, and a lot of people think that because we're in 2018, that stigma has gone away. And unfortunately, it has not.
Right. And one of the reasons we thank you for reminding everyone of that, Marvin. And I think one of the reasons we obviously brought you and Khafre on board is because of your work in the South, where it's understood that stigma is particularly common and disclosure is particularly hard. Not to say it's easy anywhere, but to say that there are areas of our country where there is more of an understanding and an acceptance, and that you all are working to make sure that's the case everywhere.
Yeah, and part of the intersections that happen in the South that overlay the South are, one, these are all what they call the Bible Belt. They're all pretty Republican states, which means there's no access to healthcare. There's no, so there's that disconnection right there. So people aren't growing up actually engaging in healthcare. So when you become an adult, if you're a gay man, a bisexual man, or a transgender woman, or a transgender man, and you haven't engaged healthcare your entire life, and now you're 18, 19, 20, now you're automatically supposed to be able to find a biomedical way to keep yourself safe of HIV in an environment that, one, doesn't love you. We still in the South are throwing families, and with the Christian overlay, are throwing gay boys and transgender women out of their houses as teens. So when you lay that over lack of education, poverty, this unequal opportunities in healthcare and employment over top of these things, and poverty, violence, institutional racism, all of that, it's even stronger laid over in the South. And so our work becomes very difficult. We just know the work that needs to be done. You add criminal justice mass incarceration into that mix. With all of that being laid deep in the South, you can lay a map on top of all of those incidents that I spoke of, and they'll be highest and most prevalent in the Southern United States.
Khafre, I know you mentioned that you have a son. I would assume that you speak openly about your status with him, and how'd you go about telling him about it and explaining it to someone very young?
I actually have 2 sons. I have
nice.
A 26-year-old who's my natural child, and I have a 25-year-old who's my bonus child. And actually, when they were both age 10, I had a discussion with them. Now, I had the discussion with them about me being HIV positive, but it wasn't the first time they heard about HIV. Because my sons were with me. They're with me. They see me speak out loud. They see me talk about things. They see me engage in community. So it wasn't like I was introducing a topic to them. I was just sharing that their father, that their Baba was actually living with HIV. And so my youngest son, who is a double graduate, he graduated from Georgia State with a double major in neuroscience and psychology with 3.9 cumulative, is in graduate school for psychology right now, on his way to medical school. He actually wants to study how disease plays on the brain. He wants to be a neurosurgeon, a neuroscientist. And so he wants to see how disease plays out in mental health. And so he's going to be wonderful in that. And so both of my sons,
really proud of him.
I am. I'm extremely proud of it. He's in his room over there. But he's extremely proud of me. He's also, my thing about that is that he also stands with me in my truth. He is one of my fiercest advocates, and I think I remember him telling me once that I'm the strongest man he's ever known. And so yeah.
I do want to ask Brandon one other question, and then we're going to have to wind up. But Brandon, I know that you had a really tough and upsetting experience happen in New York. Can you talk about that at all? And I know that's not necessarily directly related to HIV, but it certainly is related to stigma.
Oh, regarding my attack?
Yeah.
All right. So at 2016, I was gay bashed in Hell's Kitchen, which is prominently a gay neighborhood.
Yeah.
I was attacked, not knowing why I was attacked, actually. I was just walking down the street with a friend, and it just happened. 4 people came up behind me with a glass bottle, and, So it was a pretty unfortunate situation, but I was very, very happy that our community all stood together, and they were able to raise money for me to help with medical costs, things like that.
And we know that one of the things you did, which I think is inspiring, is you publicized that as a way of, again, increasing understanding and sort of turning something, you might call it making lemonade out of lemons, turning something really tough and upsetting into something that could help other people. So I just wanted to point out sort of your courage and your innovation in doing that. And obviously, I'm glad that you seem to have recovered from that.
I did. And thank you for that. Like I said, I find when you're transparent about stuff in your own personal life, even though it hurts, sometimes it actually helps every time you talk about it. So,
sure. So if, we're going to ask you all each one last question, and that is, if you could give advice to someone who wants to become an advocate about HIV, how do you recommend they go about doing it? So let's start off with Marvin answering that question, and then we'll go to Khafre, and then we'll go to Brandon.
I think the first thing that you can do is find a local organization that's doing the work to combat the HIV and AIDS epidemic in your local community, and begin to volunteer, begin to plug in, and begin to lend your services, your skill set, because a lot of times people may think that advocacy is this big super duper thing, but it's really just showing up, bringing all of you to the work, and being willing to invest your time, your skill, your talent to make sure that we all offer ourselves to help end this epidemic. And so Great. That would be my suggestion.
And for people who even still don't know where to look in that, Marvin and Khafre and Brandon will be able to answer online questions on Facebook afterwards. So feel free to post and say, hey, I'm in this area. I don't know where to look. And they'll try to make a connection for you.
Absolutely.
Thank you. Khafre, you want to add to that as to how somebody can get started as an advocate, and that might even affect their personal experience being HIV positive?
Yeah, what I would say is you first have to educate yourself. You have to understand what the epidemic looks like in your local jurisdiction. You have to understand what the policies are that negatively affect those kind of outcomes, right? You have to know where the bones are buried and what are systemic kinds of policy issues that are drivers of the epidemic in your area. And quite honestly, regardless of race, regardless of religion, regardless of sexual orientation, you need to be willing to speak truth to power. You need to be willing to understand the principle of Ubuntu. Ubuntu is a Southern African kind of concept that I am because you are. And so without you, I'm not. And so there's no greed in that, because our world has felt everybody's an I statement. But Susan, without you, I'm not. And so we have to understand that and connect in a really different way. And if we're connecting in a really different way, then we see that everyone deserves universal health care. Everyone deserves housing. Everyone deserves access to education. Everyone deserves to have access to harm reduction. Everyone deserves, everyone. And so when we come into a universal thinking on that, then, and you join with other people that are universal thinkers, you do those things. My father had an 8th grade education. He lied about his age and went in the Marines at 15. But what he told me is if you ever want to do movement work, you start working your plot and connect your plot to somebody else who's working their plot, and just continue to put those plots together. And eventually you will have a community.
Thank you, Khafre. That was beautifully stated, and talk about the value of community. Brandon, is there anything you want to add at this point about what role, how people can get involved in advocacy work?
Yeah.
And the different ways to do it, because you've done it a totally different route.
Well, what I wanted to say, the reason why I also agreed to do this is because I'm myself is always learning more about, the community and also about HIV. So that's why I've only been positive for 3 years. So I definitely have a lot to learn. That's why I want to do this from people that are experts and have been, advocates for a lot longer than I have. What I would recommend is I would do easily like a Google search for your local area just to see if there's any programs that are already existing. But if not, one way to be a great ally is you could start something. If there's not a good presence in your area for advocacy for HIV, you could always start something, and I think that's great. But again, as someone said earlier, education though is key though. So to educate yourself is definitely very important.
Great. Thank you for that. As you all can tell, we've run over, and that's not a surprise given the incredible importance and richness of this discussion. I want to thank each of you for being able to be with us today. Sorry for all the technical issues we had, but I think we managed to pull off a great conversation.
Thank you for having us.
Thank you. Thank you, Marvin.
Thank you, Susan. And
Thank
Susan,
you,
I forgot
Khafre. Go ahead.
I forgot to say today was a pre-release of my book, Sanctified Stigma. So if you go to my website, stigmocracy.org, all of the things that we talked about today, Sanctified Stigma is the story of HIV stigma in the Bible Belt. And so it's the pre-release starts today. So if you go to my website, I would love for you to join me in the journey, learning information. So thank you, Susan, for having me. Thank you again.
Khafre, anything you want to add? Khafre's coming back to us. Sorry about that. I did that kind of fast.
No worries. I'm working on several other book projects. I actually independently published Sister Speak, was a collection of voices and stories with women living with HIV in September of 2017. But when it was released, there was just this overwhelming response from women who were not in the book. And so I'm actually doing volume 2.
Wow.
I recently found out, because I had to update my CV, that Cornbread, Fish, and Collard Greens, Prayers, Poems, and Affirmations for People with HIV, my first independently published anthology, is number 15 of the best 100 HIV books of all time. And so,
wow.
I'm working on that. I'm working on an anthology called He Ain't Heavy, collecting the voices and stories of heterosexual men who are HIV positive. Working on a book called It's Our Turn to Speak, trying to get the youth to respond to HIV. Working on an anthology called Trans Voice Shout Out Loud, collecting the voices of the transgender community in response. And it goes on and on and on. So if anybody wants to connect, find a way to share their story, I see you in Jackson. Please just send me. I see you in Pittsburgh too. Send me. Just direct me Facebook like Marvin did before I met him.
Use this Facebook Live section to share your comments and your questions, and we'll connect everyone up. Brandon, any performances coming up that the New York region shouldn't miss?
Just come out to Fire Island, and I work at Cherry's, and come see me at the Doctor's Walk at the clinic. I'd love to meet all of you guys. Thank you again, Susan, for having me.
Great. Thanks to all of you. Wish you all the best. We're honored to have had you. And for those of you who are watching, don't forget you can join Health Stories Project by just going to our website, healthstoriesproject.com. We'll have another event next month. Keep an eye out on our Facebook page for the topic of that event. Thanks everybody for coming, and thanks for the team here for producing this.